Hi, ladies. It is Breast Cancer Awareness Month, and I just want to share some little information I have on breast cancer and some other things. When I was an undergrad, I did a research on breast cancer, and I found out that Nigerian women actually have a high chance of getting breast cancer. But the issue is not the fact that Nigerian women have a high chance of getting breast cancer. The issue is that most of these women present to the hospital or get diagnosis when this cancer is in its late stage, like between stage 3 and stage 4. And in during those times, there is not much treatment that can be done for these women, and so eventually leads to there is serious of high mortality rate of Nigerian women because of breast cancer. And I also want to just add that breast cancer is one of the leading cancers affecting people, in fact, affecting women in Nigeria, and generally one of the leading cancers in Nigeria. But I feel like the most basic thing that is necessary for us to combat this breast cancer is the breast self-examination, and it is so basic, yet a lot of women do not do it. And the point of this breast self-examination is just to determine if you are at risk, or if you ever or have any chances of having breast cancer.
And there are actually a few ways to do this. You can do it lying down, or you can do it standing up. The standing up method is that you stand in front of a mirror with your shoulders aligned, and you put one of your hands on your hips. I'll put the picture up. One of your hands on your hip, and using the other hand, your 3 fingers, you massage, or you rotate around your breast, starting from the outer corner of your breast, coming into the middle, going around and out until you get to your nipple. And the point of this breast self-examination is to check for the symmetry of your breast, check for the size of your breast, to check for redness, dimpling, puckering, just different things to ensure that you are in a very good state of health. And I just want to say that peradventure you see or check your breast or do this self-examination and you find out there is a lump, do not panic. Sometimes it is not cancer, but it's just important that you know exactly what stage your breast is or they are. So if you ever find yourself in a situation where your breast have like a lump or a hardness to it, or it feels like it's bringing out discharge or redness, just visit the hospital, because sometimes it might not even be cancer at all, but it's better to be safe than sorry. The second method for checking, breast self-examination is lying down. You can lie down, put a pillow behind your shoulders, put just the same way, put your hand on your, on your head and behind your head, rather. And then you use your 3 fingers and check, massage from the outward, inward until you get to your nipples. And they are both very simple methods. You don't need to buy extra things or anything for that. So I do feel like every woman should at least do breast self-examination every month, especially after your period. And this is just to check to check where you are, and so that we can help ourselves as women, and we don't always have to, as Nigerian women, don't always have to come down with issues or get to the point or no return before we get treatment for ourselves. Love you guys.